him pulling his head up and kind of moving away from me, and there's a big head toss there. So I'm just going to pull it out until he starts. So Oli here is in his mid-20s, and he was originally brought to me for head shakers. So he will just do a bunch of stuff with his mouth, with his head, just start doing some head shaking when he's under saddle. And they noticed that when he would get adjusted, it wouldn't happen for another month or so, and I had him on an 8-week schedule. So Oli gets adjusted about every 4 weeks now to help with the head shaker syndrome, and it's been doing a lot of good for him. He's used for lessons, and so when he was doing his head shaking stuff, it would really just prevent him from being used as a lesson horse as much as they would have liked. So now he's on a monthly schedule for his adjustments. And for most horses, I usually start in the back end, but for his head shaking stuff, I like to make sure that he's clear up at his pole and at his hyoid before I go do anything else. And his back feels pretty good. So the biggest thing I found for head shakers is to check the hyoid and see if they're sensitive up under here around the hyoid apparatus. He feels pretty good on this side. Let's check him on his right side. That actually feels pretty good today as well. So that's really good. So the way that I like to check for hyoid sensitivity is up in between the jowls, especially where the mandible curves towards the pole. So when I'm checking the hyoid, I'm checking it up under here, but up underneath. So what I'm doing is you can either go right in front of the halter, so you can go right up in here, and I just curl my hand up and inside of the jowl to check for that sensitivity. And really all I'm trying to do is match the tension. So I'm just pushing until I hit tension in the soft tissue, and that's good enough. I don't want to force a reaction or force the head to come up. So then on the other side, it's the same thing. So I'm going to go right here, right in front of the halter where the jowl curves up, kind of towards the TMJ, towards the pole, and just apply that nice, easy palpation pressure up there and see if I get any head tossing or throwing that head around. And he's not, so that's really good. That's a big improvement from how he is normally. And then anytime you have a hyoid issue or you suspect hyoid, you also want to check up at the pole. So here's left side of his pole, seems pretty good there, and here's right side of his pole. You can see him pulling his head up and kind of moving away from me, and there's a big head toss there. So because we know he has head shakers and I have sensitivity at the right side of his pole, usually pole sensitivity that's unilateral also goes with hyoid sensitivity that's unilateral. I cannot talk right now. Pole sensitivity that's unilateral, meaning that it's on one side, meaning one. If I do have that, then hyoid sensitivity unilaterally goes together. So if I have pole sensitivity on one side like he's got there, then I either have hyoid sensitivity on that same side or it's coming. So I'm going to treat it like that hyoid sensitivity is already present on that right side, and then I'm going to recheck this pole on the right side to see if he's sensitive there as well. So the way that I like to take care of unilateral hyoid sensitivity is just by getting a decent hold of the tongue and just pulling it out to the side, opposite the side that's sensitive or opposite the side that I anticipate there being an issue. And I'm just holding it out, giving him something to pull against. And I want him to react by pulling his tongue back into his mouth, just like that. So I'm just going to pull it out until he starts to pull it back in. There we go. And I'm just going to hold this for 15-20 seconds. You'll notice that on younger horses, you'll get a much more, you get a much bigger reaction. They'll be much more sensitive to this. Older horses and, ranch horses, team roping horses, they're kind of, desensitized, and they're not going to be as reactive to this. So on those horses, just like you're seeing with him, and you can see how he's starting to react more and pull that tongue in, you just want to be a little bit more patient, you know, maybe pull the tongue out a little bit farther to try to get that reaction started. There we go. And this is what I want. So big gaping of the mouth. There we go. Really trying to pull that tongue back in. Good. There we go. That's what I want to see right there. And keep in mind, I am not yanking, I'm not pulling. All I'm doing is holding the tongue out of the mouth. I'll take it out until I hit tension, until he starts to tighten up and get ready to pull that thing back in. But I'm not yanking the tongue, I'm not forcing the tongue. I'm just pulling the tongue out, giving him a little bit of tension, something that he can pull against to try to loosen up the muscles up there that attach to the hyoid on the right side that perform that muscle of retracting that tongue, pulling it back in towards the mouth on that side. And you can see with him just standing here, there's a big deep breath there. He's just still standing here licking his lips. His head is nice and low. There we go, we got a really nice head shake. So that's the trifecta right there. Low head, deep breath, head shake. Those are my 3 favorite things. I like when they're standing here licking their lips, you know, and chewing as well. But I think that reaction is pretty overrated in my opinion. So I would much rather see the lower head position, the big deep breath, and that head shake. Those 3 things are the trifecta for me. That's what I'm after. So really, really good signs there. All right, so now what I'm gonna do is go back up onto his pole, recheck that right side. There we go. There. Nice and comfortable now. You see that? It's beautiful. So that's what I want to see. And you'll be surprised if you do that method by taking the tongue out, how much that helps the sensitivity issues at the pole. I mean, look, I'm just shaking his head around, moving that thing around, no problem, and he could care less. And then the head goes right back down, ears are nice and flat. That's what I love to see. So if you guys want to learn how to do this tongue movement, if you want to learn how to stretch the TMJs, if you'd like to learn how to stretch your horse's entire body, just go down and check the link in my description, and that'll take you to my equine stretching masterclass where I teach you over 28 stretches. It's about an hour and a half worth of content on there. And I teach you how to stretch every major area of your horse's body from his poll all the way back to his pelvis and all 4 legs. So if that's something that you'd like to do, check out my equine stretching masterclass at sporthorsechiropractic.com. And again, thank you so much for watching. This stretch is going to be for rotation of the neck, and I'm going to be stretching her to her left side, but if I'm stretching her to the left side, I'm actually stretching the muscles on the right. So to do this one, we're going to start just like we started the last stretch when we were stretching the pole and lateral flexion, and then we're going to move down her neck. And I want to try to get all the way down into this crevice right before her shoulder, which is where the last vertebrae in her neck, C7, meets up with the 6th vertebrae in her neck, C6. Now as we rotate her neck around, the farther we rotate around, the lower in the neck we're engaging as far as the vertebrae are concerned. So this is a good evaluation technique that I use to determine where I need to adjust her, because I know if she's comfortable rotating her head about halfway and then she gets tight there, I know she's at least good as far as the motion in the vertebrae through her 4th cervical vertebrae, which is halfway down her neck. And then if she gets tight past that, then I know I'm dealing with a C5, a C6, or a C7. And a good way to get that stuff moving properly is just to stretch through those joints. So what I do is I